My name is Vaibhav. I'm 33 years old. My heaviest weight was 238 kgs. I tried many things for almost 15 years, but I was not able to lose weight. But recently my parents suggested that I should get bariatric surgery. First I was against it, but then slowly I got into that idea. Then they introduced me to Dr. Sandeep Aggarwal. And in Manipal Hospital I had bariatric surgery done about 2 months ago. And since then I have lost around 29 kgs. And I am continuing to lose according to my exercise and self-control levels of eating. So basically, I think that this is one of the best things that has ever happened to me, because for almost half my life I was trying to lose weight, but finally now I'm able to do it, actually do it.
Yeah, Vaibhav is a young, boy who had obesity since adolescence. Since the age of 15 years, he had severe obesity, which progressed to very, very severe obesity. At the age of 33 now, his weight was 238 kg and a BMI roughly touching 80 kg per meter square. Of course, so this again is severely obese, and his both parents are doctors, and they had tried all the non-surgical means earlier for his weight loss, including lifestyle modification and other means to reduce weight, but they all failed. So after proper search and all, they came to me regarding opinion about bariatric surgery. They were not initially very motivated, but after we showed them the results of such similar patients in the past. We had one such patient earlier of 250 kg we had operated about 6 years back, who is now 100 kg. So after listening to that story and also other benefits of bariatric surgery, they agreed, and Vaibhav also agreed for bariatric surgery. But of course, Vaibhav, the weight being very high, we had to really prepare him very well, because operating on such patient carries its own share of problems. There are increased risk of especially venous thromboembolism. That means a clot forming in the leg veins going to the lungs, which can be really life-threatening. So that's one of the biggest risks in operating such high BMI patients. And the other problems are technical difficulties during surgery. That means including placing the patient on the table, putting the instruments, putting the trocars, because there is a thick fat of the abdominal wall. To get to the trocars is itself a challenge, and also the liver is very heavy in such cases, which makes surgery extremely challenging. So preparing meant he was put on a 3-week liquid diet so that he loses about 8 to 10 kg before surgery. That makes his breathing better, his tolerance to surgery better, and more importantly for surgeons, the liver becomes lighter. So now and also a lot of other preparation, including anesthesia, evaluation, which was very crucial. The support of anesthesia department and the OT staff, it was very crucial. That included a really large bariatric table with the straps to secure him, various anesthesia equipment for difficult airway, intubation. So anesthesia has a huge role in helping for surgery of such patients. So with the help of everybody, the OT staff, the excellent anesthesia team we have in Manipal hospitals, and our own surgical team, we did a successful sleeve gastrectomy in this patient. He was discharged on second or third day. He was made to walk almost 4 to 6 after surgery. He was made to walk. And next day he was walking, with a stick. He had some old fracture in his right leg with an implant, so he was using a stick. But he was able to walk on his own. And after being discharged, he was mobile, pretty active, very cooperative, very positive, almost always smiling. In 2 months, he's lost 29 kg, which is really remarkable. And he remains very motivated. And I'm sure, like the previous patients who had such severe obesity, he is likely to lose a very good amount of weight. And we expect him to come around 100 kg in 1 to 1.5 years. Thank you.